Assalamu alaikum, Ramadan Mubarak to you all. My name is Malak Rohi Abudoreg, and today I will be briefing over the contents of the femoral triangle as well as these contents branches as they progress along the thigh and along the leg. So in this first page, I have a quick mnemonic that I found if you're struggling with memorizing or orienting yourself with the order of the contents of the femoral triangle laterally to medially. So you can take a look at it, write it down, and try to memorize it this way. Also, it is very important to add to the mnemonic the lateral cutaneous nerve of the thigh, which is the most lateral structure in our triangle. I've asked our doctor, and she said that if we were given both options of the femoral nerve and the lateral cutaneous nerve of the thigh, the most lateral would be the lateral cutaneous nerve of the thigh. So just keep that in mind. So to start with, which was the main goal of the video, is the femoral nerve. Alright, so again we have the inguinal ligament, which is the really bad drawing right here. This is our femoral inguinal ligament, and then we have the femoral nerve that is coming from the lumbar plexus, specifically from L2, L3, and L4. So all of these gives us the femoral nerve, which again is the main supplier or nerve supply, one of the main nerve supplies to the thigh. All right. This is inguinal ligament. Here would be our anterior spinal superior iliac spine and our pubic tubercle right here. And then we have the femoral nerve passes through here. Right. This is a really bad drawing again. So it passes right here, and then 4 centimeters right under this inguinal ligament, we will have it branch into all of its it's basically branches. We have our anterior division and posterior division, and each part of these are the ones that supply specific parts of our muscles or cutaneous divisions. Let's be more specific about femoral nerve, which is somewhere around here. If we had to use Dr. Suni's PowerPoint, I'll just use this drawing real quick. We want to know where exactly it runs, and it's very clear in this picture. So as you can see, it runs like this, and right at the iliac, behind the inguinal ligament, around 4 centimeters, it branches to our anterior division colored in orange and our posterior division colored in yellow. It was mentioned in the PowerPoint, Dr. Suni mentioned it very briefly. As you can see, this is our psoas major, and the femoral nerve runs to the lateral side. So this is the lateral, and this is the medial part of the psoas major. The femoral nerve runs right by the lateral aspect of it, and then it also goes behind. So we have our kind of the fascia iliaca, which is somewhere around here. The femoral nerve passes behind it. So as you can see, the highlighter is covering it. It's a bit clouded. So the femoral nerve runs behind it and also posterior to the inguinal ligament. Right, so now that we covered its pathway up until to the femoral triangle, we know that it's very important to note that it does not pass to the femoral sheath. It is one of the most lateral structures in the femoral triangle. It's not the most lateral. We have the lateral cutaneous nerve of the thigh, which is somewhere around here, which is the most lateral, but it is the most lateral apparent or fully immersed in the femoral triangle that we could consider, because the lateral cutaneous nerve of the thigh is on the tip, basically the cortex of the lateral aspect, but most prominently is the femoral nerve. And obviously now we're going to talk about the branches of the anterior and the posterior. So each one of them has a cutaneous branch. So cutaneous supplying sensory innervation, and we have the muscular branches. Let's start with the posterior aspect because it has the least branches. We have the cutaneous branch, which is called the saphenous. So the saphenous, you'd expect kind of have a slight idea of where it goes, because we know the saphenous opening. We also know the great saphenous vein, where it empties up or where it drains from. We can get a brief idea of where the saphenous nerve branch of the posterior nerve comes from. We also have the muscular branch to the rectus femoris, or the quadriceps femoris to be specific, so all of the quadriceps muscles. So now let's move on to the anterior division, which gives us our sensory or our cutaneous branch, which is the one that supplies both the medial thigh as well as the anterior part of the thigh, which is through the intermediate cutaneous nerves that supplies the anterior thigh, and the medial thigh, which is the medial cutaneous nerve of the thigh. And the muscle branches, you can think of it as SPs, usually face anteriorly. So the anterior division of the femoral nerve anterior division of the femoral nerve supplies the serratorius and the pectineus, which are both a part of the femoral triangle, right? So I know it's a bit messy, but this is basically all we need to know about the femoral nerve. So if we want to go back to the other parts of the femoral triangle, and we know two more very important ones. We have the vein, that is the most medial, obviously, other than the femoral canal, which is the most medial, but medial in comparison to the femoral nerve. We have the femoral vein, and also intermediate between them, intermediate compartment of the femoral, in the lateral compartment of the femoral sheath is the femoral artery. And we know the femoral artery is basically a branch of the external iliac artery, which together with the internal iliac supply into the common iliac artery. Okay, so actually the internal iliac arteries gives us supply of the, I'm not sure which muscles, but I think they meet the I'm not sure, I'll check in a bit, but yeah, so same thing with and then the femoral artery continues after passing through the adductor hiatus, which is basically the between the adductus magnus, and gives us the popliteal artery. Okay, and then same thing for the femoral vein, which I just briefly wrote right here. Just bear with me for a moment. So around, okay. So the femoral vein is from the dorsal arch, which drains into the popliteal, and after the adductor canal or the adductor hiatus, it becomes the femoral, which drains into the external iliac vein. Again, joins with the internal iliac vein into the common iliac vein. And this is after the inguinal ligament does it become the external iliac vein. This is mainly what we need to know about the three vascular components, and the nerve components of the femoral triangle. We also want to just briefly mention, because Dr. Sunni mentioned it very briefly, but we have three compartments in our femoral sheath. We have two things here. We have one thing here and then one thing here. Let's start with the most medial is our femoral canal, and the base of it is the femoral ring, which the doctor mentioned as a weak spot. All right. And then the intermediate one is the femoral artery. After it, before it used to be the external iliac artery, now it's the femoral artery. And then the most lateral, when it comes to the femoral sheath, is the this is the vein, and this is the artery. And we also have the femoral genitofemoral nerve, which is a branch of the femoral branch of the nerve. Femoral branch of the femoral nerve. Okay. Alright. So this is it for this part.